Now we are going to talk about the surface landmarks of the thorax, body landmarks. Now first of all, we are going to talk about the suprasternal or the jugular notch. The suprasternal or the jugular notch. It is swelled just above the superior border of the manubrium. So this is the manubrium and it is swelled just above the superior border of the manubrium between the sternal ends of the clavicle. So it is the clavicle, and between the sternal ends of the two clavicles on either side and above the superior border of the manubrium is felt the suprasternal or the jugular notch. It lies at the level of the lower border of the body of the second thoracic vertebra. So if we trace it behind, its level is going to lie at the lower border of the body of the second thoracic vertebra. The trachea can be palpated in this notch. So if we're going to palpate trachea, it can be palpated in this suprasternal or the jugular notch. Now second, the sternal angle of Lewis. The sternal angle of Lewis is felt as a transverse ridge. So it is felt as a transverse ridge 5 cm below the suprasternal notch. So the sternal angle can be felt as a transverse ridge 5 cm below the suprasternal notch or the jugular notch. Now the sternal angle of Lewis, it marks the manubriosternal joint. So it is a junction where the manubrium of the sternum joins with the body of the sternum. So it is the sternal angle of Lewis is the junction between it is the manubriosternal joint and lies at the level of the second costal cartilage anteriorly. So it lies at the level of second costal cartilage anteriorly, and disc between the fourth and fifth thoracic vertebra posteriorly. So if we're going to trace behind, we are going to get the disc between the fourth and the fifth thoracic vertebra, the intervertebral disc. So this is an important landmark for the following reasons. Now the reasons that we are going to do are very important. The first reason, the ribs are counted from this level downwards. So we're going to count ribs for a surgeon, to count ribs for a general physician, to count the ribs. The first prominent landmark is the sternal angle from which second rib, the costal cartilage of a second rib, can be traced. The ribs are counted from here by tracing the finger downwards and laterally, because the lower costal cartilages are crowded and anterior parts of the intercostal spaces are very narrow. Also, it marks the plane which separates the superior mediastinum from the inferior mediastinum. So this is the plane, imaginary plane, which is separating the superior mediastinum from the inferior mediastinum. Also, the ascending aorta ends at this level, and the arch of aorta begins and also ends at this level. So at this level the ascending aorta is going to end, and the arch of aorta is going to begin and end also at this level. The descending aorta begins at this level. The trachea divides into two primary bronchi. The azygous vein arches over the root of the right lung and opens into the superior vena cava. So the azygous vein is going to arch over the root of the right lung, and this going to open at the root, open in superior vena cava at this plane, the plane of the sternal angle. The thoracic duct crosses from right to left side at the level of the fifth thoracic vertebra. So thoracic duct is going to cross from the right to the left side at the level of the fifth thoracic vertebra and reaches the left side at the level of the sternal angle. So the thoracic duct is going to ascend and going to cross from right to left side at the level of the sternal angle, and reaches the left side at the level of the sternal angle. It marks the upper limit of the base of the heart. So the base of the heart, which rests posteriorly, the superior part, the superior line of the base of the heart is being marked by the limit is being marked by the sternal angle. The cardiac plexuses are situated at the same level. The cardiac plexuses are also situated at the same level. Now we're going to talk about the xiphisternal joint. Xiphisternal joint. The costal margin on each side is formed by the 7th to 10th costal cartilages. Between the two costal margins there lies the infrasternal or subcostal angle. So between the two costal margins is going to lie the infrasternal or subcostal angle. The depression in the angle is also known as the epigastric fossa. So the depression in this angle is going to be called the epigastric fossa. The xiphoid process lies in the floor of the epigastric fossa, and the apex of the lung, the xiphisternal joint, may be felt as a short transverse edge. It lies at the level of the upper border of the 9th thoracic vertebra. The xiphisternal joint. If we're going to talk about xiphisternal joint, it is the joint between the xiphoid process of the sternum and the body of the sternum, and it lies at the level of the upper border of the 9th thoracic vertebra. So we're going to trace backwards, then we're going to find the level of the upper border of the 9th thoracic vertebra. The costal cartilages. The costal cartilages. Second costal cartilage is attached to the sternal angle. The second costal cartilage is attached to the sternal angle. The 7th cartilage bounds the upper limit of the infrasternal angle. The 7th costal cartilage is going to bind the upper part of the infrasternal angle. The lateral border of the rectus abdominis or linea semicircularis. The linea semicircularis here joins the costal margin. The costal margin is the tip of the 9th costal cartilage. Are very important that the lateral border of rectus abdominis, which is also called linea semicircularis, is going to join the costal margin at the tip of the 9th costal cartilage, through which also passes the mid-clavicular plane. The 10th costal cartilage forms the lower part of the costal margin.